Aid Workers Unfiltered by the KALU Institute.
Episode 1: How to have meaningful mental health and psychosocial support interventions during humanitarian crisis.
I'm depressed enough as it fucking is.
We all need emotional support at some point in our lives, and we could all be in a situation where we suffer from mental health disorders. But some situations can be triggering, especially in times of crisis. Today, we're going to see with Nuria and Arz, MHPSS experts, what can be done in humanitarian settings. During a conflict, for example, people see their mental health vastly challenged.
Currently, Afghanistan has one of the worst humanitarian crises. People are under high levels of poverty, lack of opportunities, especially women with no freedom to move, no possibility to work, to access education, high levels of violence and high levels of stress. People are feeling uncertainty, depression, anxiety, and, for example, high levels of suicide cases were detected in the last month.
Facing this kind of situation, we will try to alleviate the emotional suffering of the affected populations, but we also want to help people to function properly.
Ensuring that the person is dignified and have a capacity to think for themselves is where we want them to be in order to be the agents of their own changes and the agents of their own solutions.
Two people living the same situation won't have the same needs, and that's what happens in humanitarian situations. It will depend on each individual. But what we see is that mental health still suffers from a kind of stigma that can prevent people from wanting to access the services.
Population who is usually coming to our mental health and psychosocial support services are women and the most vulnerable population, for example, adolescents and as well children or gender-based violence survivors. Not because men are not in distress, but because of resistance for the culture, for the context that might prevent some of those men to seek for support.
Not all the people are in need of a medical assistance. Many can solve their well-being problems with basic social networking, with discussing and building friendships with each others, and having a safe space where they can just be themselves and do whatever suits them in order to be able to cope with the harsh reality.
So how should we implement these types of projects, and what should be the first steps?
The first key point is that we should not consider MHPSS services and support as a standalone sector or let them become isolated from other services. The MHPSS services and interventions should be integrated in general community support and programs, including education, protection, public health. The MHPSS should be conceived as an approach in all programs, ensuring that the main intention is safeguarding the dignity and the resilience of the persons who are affected. Any type of MHPSS intervention is also linked to the ongoing or integrated to the ongoing general health system. So using what we have from community-based mechanisms to formal systems is very important. So we need to build on them and strengthen them in a way.
Especially in emergencies, we can sometimes forget that the first responders will always be community members. And that's what we're going to take into account when we want to provide MHPSS services.
There are many countries that they don't have psychologists as we understand this role. And we need to do capacity building to other profiles from social welfare, health staff, or even sometimes community leaders who might be able to be trained and have basic counseling skills to support the population as first responders if there is any kind of crisis. Usually community empowerment is essential. In the end, they are the ones in country, they are the ones who understand the culture, who understand the challenges.
Victims, beneficiaries. With these terms, we can lose sight of the fact that people are not only victims, they are individuals with skills, capacities, and strength, and we have to build on them.
One example of my work I usually like to mention is when I went to Philippines for one of the biggest typhoons in history in 2013-2014. When I arrived, I saw dead bodies everywhere. disaster everywhere, houses destroyed. Most vulnerable population lost everything. And we started all those psychosocial support groups with mothers. I remember one of those mothers who lost everything. She lost her husband, 3 kids, and her mother, plus the house and her small shop. That was the livelihood for the whole family. This woman was coming to our activities. Her coping mechanism was to wake up every morning and trying to help the rest of the mothers. For sure, in the future, she will need to face all this traumatic experience she had to live. But her resilience for me was something to admire and was something very inspirational for the rest of the mothers. In Philippines, I really saw this resilient attitude in most of the population that they are facing natural disasters almost every year.
So what should be our first actions to plan a response? Figuring out who needs what to be able to tailor the intervention, and not forget that we can work with the communities before an emergency arises.
A side that is preventative with information sharing and community-based interventions, etc. But also there's a part that helps us respond to the needs of mental disorders, focusing more on a specialized type of intervention. Basic needs and the family and community MHPSS intervention can be done for a bigger number of population. From there, we can screen people who are in need of further support to alleviate their protection and their well-being. For the need of mental health intervention, we should be taking steps to introduce psychotherapeutic interventions that are appropriate for the emergency or for the response that you are planning to do. As much as possible, avoid excessive prescription of psychotropic medication.
MHPSS can include individual counseling, referral systems if the services are available, the setup of safe and protective spaces, for example. Focus groups are also widely used and are deemed really effective in challenging situations.
One of the very common activities we use to implement is psychosocial support group. For example, in Nepal, during the earthquake, we did psychosocial support groups for women, and we offer a safe space where they could share how they feel, they could recognize their symptomatology as normal after a stressful event. So it was useful for them to realize they were not alone, they were not crazy because they had insomnia or other symptomatology. They understood they were normal reactions to an unusual event. They realized many of other women in the same situation felt the same thing. And just this realization reduced their stress, reduced their tension. They felt safe, not judged, and a space where they could establish a support network. And it had a really big impact in their emotional and well-being.
Thanks a lot to Nuria and Arz for their testimonies, and stay tuned, more episodes soon.